Okay, everybody, welcome back to another deep dive.
Yeah.
And today we're going right into the world of
Emergency medicine.
emergency medicine. Yeah,
Yeah.
we've got a real case here, a real pet parent.
Absolutely. Yep. Real life happens every day. We've got a case here where we have an internet search, right? People go to the internet all the time to try to find information. So we have an internet search and we have the actual veterinary medical record. And so we can see what happened when this pet parent was concerned. They went online, they looked for some information, and then they went to the veterinarian. And we'll see, did they find the right information? What did the veterinarian think? How did it all play out?
Yeah, this is a 12-week-old puppy named,
Yeah.
and the internet search, I'll read it verbatim here. It says, is having vomiting and diarrhea. He is a 12-week-old puppy, no vaccination history. There is hemorrhagic diarrhea. He is listless and has labored breathing.
Yeah, that's a pretty scary internet search right there. As a veterinarian, as soon as I hear, a young puppy, 12 weeks, no vaccines, and then, vomiting and diarrhea, that's one thing. But then you throw in hemorrhagic diarrhea,
Yeah.
blood in the stool,
Yeah.
and listless and labored breathing. I mean, those are all very, very serious signs in a puppy that young.
So you kind of hit on it there. So from the veterinarian's perspective, what are some of the key things here that are like red flags? You said young age, no vaccination history, and then obviously those specific symptoms. But is there anything else there that's particularly worrisome?
Well, it's a combination of all those things, right? So you have a young puppy. So they're not as strong as an adult dog would be. Their immune system isn't fully developed. They're more prone to dehydration, especially with vomiting and diarrhea. So you have a young puppy, not vaccinated, and then you have these really severe signs of hemorrhagic diarrhea, which is a bloody diarrhea, listlessness, meaning they're just not acting right. They're very lethargic, and then labored breathing. So all of those things together are very, very concerning.
So we're going to go to the medical record now. And we see here that the veterinarian has a differential diagnosis list. And just for context for our listeners, a differential diagnosis list is basically a list of all the possible things that could be going on. And then the veterinarian uses their diagnostic skills and tests and things like that to kind of whittle that list down until they find the right diagnosis. Um, so let's see here. We have parvovirus listed. We have gastroenteritis. We have intestinal obstruction. And we have hemorrhagic gastroenteritis.
Yeah.
So pretty serious stuff.
Yeah, and these are all, very serious things that can cause these kinds of signs in puppies, especially young puppies. But I think the one that stands out, right away, especially with the no vaccination history, would be parvovirus.
Yeah, and looking at the final diagnosis, we see that the veterinarian diagnosed parvovirus, primary, and then secondary to that is dehydration.
Yeah, because with parvovirus, one of the main things that happens is they get really, really dehydrated from all the vomiting and diarrhea, which is what leads to a lot of the other problems, the lethargy, the weakness, potentially even, things like seizures and coma.
So really, really serious stuff. So let's talk about parvo a little bit. What is parvo and how is it spread?
So parvo is a virus. It's a very, very contagious virus that attacks the lining of the intestines. It's spread through the feces of infected dogs. So if a dog has parvo and they poop somewhere, that virus can live in the environment for a very long time, weeks to months, even up to a year, depending on the conditions. So other dogs can come into contact with that contaminated feces, and then they can, ingest it. They can lick it off their paws, things like that, and then they can come infected as well.
Okay, so it's spread through the feces. It can live in the environment for a long time. The thing I always hear about parvo is that it is incredibly hardy.
Oh, yeah.
It's not easy to kill, so to speak. So what are some things people can do to try to mitigate that risk?
Yeah, so parvo is very resistant to a lot of the common disinfectants that people use. Your basic household cleaners are not going to be effective against parvo. There are some specific disinfectants that are effective against parvo, things like bleach solutions, but you have to use them properly. You have to make sure you're using the right concentration. You have to let it sit for the right amount of time, things like that. And you also have to be careful because, bleach can be damaging to surfaces and things like that.
Okay, so back to situation. He's in the hospital now. He's been diagnosed with parvo and dehydration. What is the treatment plan for something like this?
So treatment for parvo is mainly supportive care. So we're trying to support the body while it's fighting off the virus. So the mainstays of treatment are going to be intravenous fluids to correct the dehydration and to provide electrolytes. We're going to give them antiemetics to help control the vomiting. And we may give them antibiotics to prevent secondary bacterial infections. And then we're just going to monitor them very closely. We're going to monitor their temperature, their heart rate, their respiratory rate, their hydration status, things like that. And we're going to adjust the treatment plan as needed.
So are those supportive care measures, are those typically done in a hospital setting? Or is that something that can be done, at home?
It depends on the severity of the case. So in a mild case, where the puppy is still eating and drinking, we may be able to manage them at home. But in a severe case like this, where the puppy is, severely dehydrated, they're not eating or drinking, they're having bloody diarrhea, they're lethargic, they have labored breathing, they need to be hospitalized, they need to be on intravenous fluids, they need to be monitored very closely.
So in case this would be a hospitalized intensive care type situation.
Absolutely. Yeah.
So really emphasizing the importance of getting to the vet as soon as possible when you see those types of symptoms.
Exactly. The sooner we can get them in and get them started on treatment, the better their chances of survival.
So let's talk about the different aspects of the treatment plan that you kind of outlined there. You said IV fluids, antiemetics, and antibiotics. What does each of those do specifically to help a dog that has parvo?
Right. So the IV fluids are the most important thing because dehydration is the main problem with parvo. So the IV fluids are going to help rehydrate the puppy. They're going to help restore their electrolyte balance. The antiemetics are going to help control the vomiting, which is going to help them feel better. It's going to help them keep their fluids down, and it's going to help their intestines rest and heal. And then the antibiotics, parvo itself is a virus, so antibiotics don't kill viruses, but they can help prevent secondary bacterial infections. So because the puppy's immune system is weakened, they're more susceptible to bacterial infections. So the antibiotics are just kind of like an extra layer of protection.
So you're supporting the immune system so it can do its job, fight off that virus, and hopefully the dog gets better.
Exactly. Yeah.
So it sounds like early intervention is key.
Yeah, absolutely. The sooner we can get them started on treatment, the better their chances of survival.
And really, that goes back to vaccination as being such an important aspect of preventative care.
Absolutely. Vaccination is the best way to prevent parvo. It's a very effective vaccine, and it's something that all puppies should receive.
So this deep dive has really kind of highlighted a lot of the hallmark signs and symptoms and treatment protocols for canine parvovirus.
Yeah.
Really emphasizing the importance of vaccination, early intervention, supportive care. What are some of the key takeaways that you hope our listeners, really take home with them after listening to this?
Yeah, I think the main takeaways are that parvo is a very serious disease, but it is preventable. Vaccination is the best way to protect your puppy from parvo. If you do see any of these signs, vomiting, diarrhea, lethargy, loss of appetite, especially in a young unvaccinated puppy, it's very important to get them to the veterinarian as soon as possible. And early intervention is key. The sooner we can get them started on treatment, the better their chances of survival.
So really, the takeaway here is to be informed and to be proactive, because when it comes to our pets, we want to do everything we can to ensure their health and well-being.
Exactly.
So hopefully, folks out there listening, take that to heart and really think about how they can apply that in their own lives.
Absolutely.
All right, well, that's our Deep Duck for today. Thank you all for listening, and we will catch you next time.
Sounds good. See ya.